Hello everybody, this is Salma Ruhi, consultant dietitian. Today I'll be briefing you regarding a common topic called as anemia. So in this introductory lecture, I would like to explain regarding the basic definition of anemia, the types of anemia, the signs and symptoms related to anemia, and as well as the dietary interventions what are required to avoid being anemic. So let's start. So the introduction of the anemia, basically the definition of anemia is low amounts of RBCs in the blood is defined as anemia. But how to diagnose that? In a basic blood test reports, the lower amounts of hemoglobin levels are defined as the anemia. Then hemoglobin, can I stop? I would like to start with the introduction of anemia. But the definition of anemia is the low amount of RBCs present in blood is defined as anemia. But in a routine blood test, it is reported as the low hemoglobin levels. We have normal hemoglobin levels, and less than that, the person is again diagnosed as being anemic. So, what exactly is hemoglobin? Hemoglobin is a protein present in the RBCs which is responsible for the transport of oxygen to the different parts of the body, which is required for normal functioning of the body. In the picture below, as you can see on the left hand side, the picture depicts that this is the normal amount of RBCs present in blood. But the right hand side picture, as you can see, the number of RBCs present in this picture are very low, which itself states that the person is having low amount of RBCs. That means the person is anemic. Then we need to know what exactly hemoglobin is. I would like to make you understand what hemoglobin is. As the name itself suggests, hemoglobin is heme and globin. There are two different parts. Heme is an iron complex present in the hemoglobin, and globin is the protein part. So combined together, it is hemoglobin which is responsible for carrying oxygen throughout the body. So we have a basic range of hemoglobin depending upon the age group. As you can see in the table, the newly born children less than 1 year old, they have a normal range around 14 to 22 grams per dl of hemoglobin, whereas 6 months old children should have 11 to 14 grams per dl. Chalo. Whereas the 6 months old child should have 11 to 14 grams per dl of normal hemoglobin levels. In children ranging from 1 to 15 years, the normal range of hemoglobin is around 11 to 15 grams per dl. Whereas in adults, men and women have both different requirements. Men has 14 to 16 grams per dl of hemoglobin levels as a normal range, whereas women should have 12 to 16 grams per dl of hemoglobin. So these range indicates that the person is not anemic and he is having a normal hemoglobin levels. Then the signs and symptoms of person being anemic are different depending upon the affected organs or the affected part of the body. So the basic, sorry, I would like to restart. The basic or the common signs and symptoms of anemia are lightheadedness, shortness of breath, then the patient or the person will have cold hands and feet, irregular heartbeats, then the person can have chest pain, and the person will have weakness, tiredness. These are the commonest symptoms of the person being anemic, but serious or the more complicated symptoms of being anemic are different. I would like to explain you that in my next slide. So here this symptoms of anemia totally depends or they are like related to the, sorry, okay, fine. I would like to restart. Okay. The symptoms of anemia totally depend upon the organ or the part of the body being affected. If the affected part is like central nervous system, the patient or the person will have fatigue, dizziness, and sometimes the patient or the person can faint because of being severely anemic. And muscular weakness is one of the major symptom of the person being anemic. That is because there is low supply of oxygen to the muscles wherein the person feels weakness. Then we have shortness of breath. Again, this is because of the lower amounts of oxygen supplied to that particular organ. Then in intestinal symptoms, we can see there is a change in color. Then we have eyes, then we have spleen, then we have skin. There is like related to heart, the basic symptoms are palpitations, rapid heartbeat, chest pain, angina, heart attacks. These are the severe symptoms of person being anemic, wherein the hemoglobin level is severely affected. Then the next symptom is spleen enlargement. Then yellowing of eyes, yellowing of skin, paleness of skin, these are again the other symptoms of a person being anemic. Was this right?
Yes, yes.
Okay. So I would like to explain you now about the different types of anemia, what we have. But we'll be speaking in detail about the nutritional deficiencies of anemia. But still, we have the different types of anemia like aplastic anemia, wherein the bone marrow is not capable enough to produce enough of RBCs which are required for our body to function normally. Then we have sickle cell anemia, that is a genetic blood disorder wherein the shapes of the RBCs are sickle shaped due to which the oxygen carrying capacity of those cells is being reduced. Then we have, uh, sorry, ये कुछ तो change ठीक है. Then we have hemolytic anemia. That means the destruction of RBCs is much more than they are produced in the body. That is called as the hemolytic anemia. Then we have inflammation anemia. If there is a chronic disease in the body, then that can again indirectly lead to anemic situations. In detail, I would like to mention about the nutritional deficiency of nutritional deficiency anemia. Those are two. Okay. In detail, I would like to explain you regarding. Sorry, I forget. Okay. In detail, I would like to explain iron deficiency anemia and vitamin deficiency anemia because today we are dealing with the nutritional intervention during anemia. So here you can see there are three different nutrients: B12, folic acid or folate, and iron. So which are responsible or which are required for basic production of RBCs. And due to deficiency of one of these three nutrients, there can be lower amount of RBC production, which can in turn leads to anemia. See, there are different types of anemia again depending upon the nutritional deficiencies, what particular nutrient is deficient, then particularly that there is a name different given to that particular anemia. Pernicious anemia, there is amount of B12 is present in the body, but the body is not capable enough to absorb that B12, due to which the person will have pernicious anemia. Then we have the second one is the megaloblastic anemia. This is a type of vitamin deficiency anemia that happens when the person do not get enough of vitamin B12 and vitamin B, that is folate, from the dietary sources. Then the last one is the iron deficiency anemia, which occurs when the body does not have enough of iron stored. That is again the lower amount of dietary intake of iron-rich foods. So, as I was talking about the iron deficiency anemia, there are two types of iron present in food which are required by the body for a normal RBC productions. So, that is again classified into two different terms called as heme iron. Then we have non-heme iron. The difference between these two, heme iron and non-heme iron, is based on the type of or the food source from where we get all these kind of ions. So heme iron, we definitely get it from the animal sources, from meat, poultry, beef, liver, fish, etc. Then whereas we get the non-heme iron from the plant food sources, it can be nuts, it can be beans, it can be lentil, green leaf vegetables to specify, contains non-heme iron. The second difference between the heme iron and non-heme iron is the absorption rate of heme iron is much greater than compared to the non-heme iron. So definitely one would like to have heme iron if the person is non-vegetarian, but if a person is vegetarian, he can have non-heme iron, but non-heme iron should be taken along with vitamin C to enhance its absorption rate. It requires, this is the secondary factors which are required for a non-heme iron to get absorbed. So vitamin C has to be taken along with the non-heme iron, so the absorption rate, we can improve the absorption rate of that non-heme iron. Then the last difference between the heme iron and non-heme iron is excessive heme iron can cause health risk, whereas non-heme iron excess, if taken in excess amount, does not cause any kind of health risk. Okay. In a conclusion, silent. हेलो हेलो. हाँ सागर, बोलिए ना. हाँ, आ गए हैं क्या? ठीक है ठीक है, चलेंगे चलेंगे. ओके, थैंक यू. Everybody knows sorry is here. Communicating between people. Okay. Conclusion of this topic is the type of iron what we are taking in, how much we are taking in, and with what we are taking in is definitely we need to know. If you are taking non-heme iron along with vitamin C, the absorption rate can be increased. As you can see, I have written here, increase food rich in heme iron and non-heme iron in your daily diet. And I've also mentioned these sources from where we get both type of iron sources. Then we need to avoid phytates, polyphenols, calcium containing foods along with non-heme iron as they inhibits the absorption of iron. So example of all these kind of anti-nutrients are tea, coffee, legumes, etc. So we need to avoid all these things along with the non-heme iron food sources to increase the absorption rate of the iron from that particular diet. Then, as I mentioned, we need to include vitamin C rich food along with the non-heme iron to enhance the absorption of that particular iron. Then, uh, okay. So I would like to conclude this topic by saying if a person is vegetarian can have non-heme iron along with their vitamin C sources. If a person is vegetarian, non-vegetarian, he can have heme iron as well as non-heme iron to improve his hemoglobin content, wherein we can avoid being anemic. Thank you.